Describe your case.
Thank you, sir, for letting me examining this patient. An old lady sitting comfortably on a bed. She had a swelling on the left side of the parotid region in the retromandibular fossa. It is displacing the ear lobule upward and backward. There was no scar mark. There was no discharge. There was no skin changes present over it. However, it is a normothermic, non-tender swelling with firm to hard consistency. The margins are well defined. However, it is mobile in one plane, that is horizontal plane, not in the vertical plane. On contraction of the masseter muscle, it is mobile in the one plane. It is not adherent to the underlying muscle. On bimanual examination, the Stenson duct was not palpated. However, there was poor oral hygiene with multiple denture present in it. Facial nerve examination is normal. That is, facial nerve is intact. Cervical lymph nodes were not palpable. Diagnosis
What is
includes,
the most likely diagnosis on clinical examination?
sir, my diagnosis is parotid adenoma, sir. Left-sided parotid adenoma, sir.
And what can be the differential diagnosis?
Sir, my differential diagnosis include preauricular lymph nodes, lipoma, and CA parotid, sir.
How will you confirm your diagnosis?
Sir, I will confirm my diagnosis by performing FNAC, sir.
So, what report you are expecting on FNAC in this case?
Sir, on my clinical examination, it's looked like a benign swelling. So I am suspecting a benign swelling, most probably parotid adenoma, sir.
And what is that called?
Uh, Pleomorphic adenoma, sir.
What did you examine within the oral cavity?
Sir, first of all, I examined the oral cavity, hygiene of the oral cavity. After that, I bimanually palpate the swelling, and after that, I felt the Stenson duct in the second premolar tooth, sir.
So, you pressed the lump and
Sir,
then examined the oral cavity.
sir,
What were you looking for?
I was looking for the lower border of the swelling, whether it was adherent or not, sir.
Some stone at in the within the Stenson duct
Sir,
or at the orifice of the opening of the
sir,
Stenson duct, and any discharge on pressing the parotid
sir.
from the opening of Stenson duct.
Right.
And how is this related to oral hygiene?
Sir, the patient has a poor oral hygiene, and there might be increased chances of silolithiasis and silodinitis, sir,
And
along with oral cancer, sir.
dental abscess as well.
Sir,
How will you know that which lobe is involved?
sir, if on contraction of the muscle, masseter muscle, if it is not mobile, then it's mean it deep lobe is involved. If it is mobile, it means the superficial lobe is involved, sir.
Would you perform open biopsy?
No, sir.
Why?
Because if there is the chances of fistula formation, there is a chances of facial nerve damage, and there is a chance of if it is a tumor, there is a chance of spillage.
So, how will you manage?
Sir, after doing ultrasound and FNAC examination of the patient, I would like to counsel my patient regarding the disease, regarding the prognosis, and regarding the complication of this disease. Complete my pre-anesthesia workup. I will get the clearance from the anesthesia colleague, and if there are any comorbids, I would like to discuss it with medical team and take them on board. After that, sir, I would like to perform the surgery of this patient, sir.
So, what type of consent will you take?
I will tell the patient about the chances of facial nerve damage, and I will tell the patient about the chances of recurrence, as it is a parotid and pleomorphic adenoma. There are high chances of recurrence. Afterward, I would tell the patient about the post-op recovery, and then I will perform the operation, sir.
So, what are other post-op complications?
I will tell the patient about the Farris syndrome, sir, gustatory sweating,
Which syndrome?
Farris syndrome,
Fraze syndrome.
Fraser syndrome, sir. Sir.
What's that?
It is the damage to the postganglionic fibers of the auriculotemporal nerve, which reroutes to the sympathetic fibers of the skin. As a result, when the patient eats something, there is sweating on the face, there is flushing of the face as well, sir.
Is there anything operatively you can do to avoid phrase syndrome?
Sir, we can put a flap over it. We can cover it with the muscle, and these are the two things we can do.
Flap means
Flap means, sir, we can use the subcutaneous fascia as well,
facial.
sir.
And how will you treat it post-operatively?
If the Fraze syndrome develops, sir, post-operatively, I would like to go for the antiperspirants. And after antiperspirants, sir, I would like to confirm it by doing starch iodine test. After starch iodine test, I would like to give antiperspirants. If there is no improvement, sir, the revisional surgery has the role, sir.
Which surgery?
Revision surgery, sir.
What's that? What
If they
type of
can put
surgery?
artificial membrane over it, if in
So
memory.
you will also consult your ENT colleague for panic neurectomy.
Sir, yes, sir,
Yeah.
sir,
Thank you.
right.